Okay, guys, so the next one is general practice, and I'm going to be running this session. I know a lot of you guys have lots of questions about general practice. I always get questions about general practice. What is it all about? How do you apply? Is it the right choice, etc., etc. So for those of you who don't know me, like I mentioned at the beginning, I'm Dr. Aman Arora. I'm a portfolio GP, now fully into medical education. My passion is medical education and helping you guys through your career pathway. I'm lucky to be a fellow at the Royal College of GPs, and I had lots and lots of previous roles to do with medical education in the past, be it examining, being assessing, be it question writing, being appraising, being helping other trainees, and very much involved in the IMG world when I was back in health education West Midlands. But as you guys now know, we run Aurora Medical Education and try and help you through various stages, including PLAB and things like MSRA, which we'll talk about in this particular topic. So the end of this topic then, general practice is a vast topic. I could talk about it for 2-3 hours, but I'm trying to keep it condensed to about half an hour. What is general practice? What are the key pros and cons? How do you apply? And what are the key assessments that you need to do? And how do you best prepare for them? So please do put questions in as they come, guys. I will try and answer questions at the end. I know there are a lot of common questions that come with general practice. So what is general practice? It's sort of a very broad term: family medicine, general practice, community medicine. They all kind of come under the same banner, but in the UK, you have your key split when it looks at medicine. You have your primary care, which is generally community-based medicine, general practice, and secondary care, and then maybe tertiary care, which is your hospital-based management. And remember, around the figure changes, but a very, very high proportion of doctor-patient contact is in primary care in the UK. So you're looking at maybe 70, 80, 90% of doctor-patient contact is through primary care. So most doctors who are on this webinar, when you come to the UK and go through the system, you will end up being GPs. So it's really important to understand what general practice is. And even if you're not planning for general practice, you still need to understand what general practice is, because a lot of the work in secondary care is going to be filtered through general practice. So, and a lot of times you will be communicating back to general practice. So understanding the system is very, very important. Like we said, a bulk of the UK doctor consultations are in primary care or in community medicine, and it's known often as the gateway of the NHS because so much comes to primary care first. Some of that then is obviously filtered out into secondary care. So it's known as the gateway of the NHS. Sometimes under a lot of pressure as the gateway of the NHS, but that's fundamentally where we are. And look, a lot of people and a lot of perceptions in different parts of the world about general practice can be very, very poor, very low perceptions. But the term now that is starting to be used, and quite rightly so, is more of a consultant generalist or consultant in family medicine or consultant family physician, just like you have a consultant cardiologist and consultant pediatrician, etc. Consultant generalist is a term that's starting to be used more and more, and again, and rightly so. And remember, the main difference, I would say, from primary care and secondary care or GP work and hospital work is that GP surgeries or GP clinics are essentially independent businesses. So they run as individual businesses as opposed to like a hospital, which we put under a trust. And all these individual businesses are run in a different way. There can be different ways of running GP practices, and that's where some of the flexibility and some of the freedoms come in. So they are part of the NHS, but they're run as independent businesses, whether it's a single GP or lots of GPs together in a big multi-GP practice or multi-GP center. So what are the pros of general practice then? One of the key things that's often talked about in general practice is flexibility. Flexibility to run your career as you like. So when you're in hospital medicine, the flexibility is there to some extent, part-time, full-time, etc., how you want to run your week. But there's no specialty where you have as much flexibility as general practice, in that you can do 7 days a week of general practice if you like, or you can do 1 day a week of general practice if you like. You can do all mornings of a week, you can do all afternoons of a week. You can work nights in out of hours general practice and no days. You can do all days and no nights. You can work all weekends and no weekdays. You can do all weekdays and no weekends. It's completely flexible in terms of how you want to work. Once you get through training, of course, you have to get through training, and when you get to the end, when you're an independent GP, the flexibility is huge. Not just when you work, but how you work. You can work as a GP partner, where you run a practice. You essentially own the business and run it as a business. You can work as a salaried or employed GP, where you work in a practice for another organization, but you have your set hours and your set roles and your set jobs. Or you can be a locum GP, where you just say, well, I'm an independent GP. I will work for different practices when I want, and I can charge how much I want. going on locum rates and regional rates. But there are so many ways that you can work, or you could be an out-of-hours GP where you just work in out-of-hours centres, weekends, nights, etc. And then you see more acute stuff rather than your kind of more chronic care, which you might see in everyday general practice. So the flexibility level is huge, and it's something that draws a lot of people to general practice. Range of medicine, Anoop was saying in the emergency medicine talk that emergency medicine is the only specialty where you see a wide range of medicine. Not quite true. General practice is probably right up there as well, and you're going to see literally everything you can think of that you've learned ever in medical school or done in any PLAB exam or MSRA exam. You will see it at some point as a GP. The rare, the common, the chronic, the acute, the pediatrics, the elderly care, you'll see the whole lot. I remember in one clinic, I had 3 patients on my list. I saw the first patient, it was a grandmother. The second patient was her daughter. The third patient was her daughter. And I saw them all one by one, and I knew the connection, I knew the link. And that was one of the beautiful things that you see in general practice, is the range of what you see. Thirdly, continuity of care. There's very few specialties where you get true continuity of care right now in the way that the NHS works. But you get to see patients throughout their journey. So you see them on day 1 of their illness, you may see them a week later, you may see them a month later, you may see them at the end of illness, you may see them literally a few hours before they pass away. That is true continuity of care, where you can understand their whole medical history, you can link presentations with previous things that you've seen before. That is true continuity of care. You can put in an implementation, you can put in a treatment, you can see how the effect of it a few months later, a few years later. You can see the whole journey from start to finish. That is a beautiful part of primary care. You can see that in some parts of hospital medicine, but in general hospital medicine, you see one doctor, something is done, and then you see another doctor later on down the line because people have moved on, jobs have moved, etc. And you miss out on that continuity. So if you really enjoy seeing processes and seeing stories start from start to finish, then GP is a great thing for that. Choose your work style, like we mentioned, you have lots of variety of flexibility, and if you want to develop other things in your career, it is probably easier to do it in general practice than when you're a consultant cardiothoracic surgeon, for example, because you can choose how many days to dedicate to clinics and then other things as well. Now, that could be other medicine passions or other non-medicine passions. So, for example, you might have you might have a GP who works 2 days as a GP in GP clinics, and then they do 2 days maybe working as, I don't know, minor surgery, or working as a GP with a specialist interest in women's health, or a GP with a specialist interest in, I don't know, endocrinology or diabetes. So you have lots of flexibility within your working week. Or you might get some GPs who say, well, look, I want to do 3 days a week of general practice, but then I want to do 2 days a week of something totally different, out of medicine, another passion, another hobby, another job, another role. And again, there's very few specialties that give you that flexibility to do things as you want to, in the way that you want to do it. And again, that's why a lot of people choose that element of flexibility when it comes to general practice. Cons of general practice, everything that's got pros has got cons, of course, and a lot of cons, I think, are perceived cons, because you can turn a lot of these cons around in general practice. But let's talk about some of the perceived cons that may well stop people going into general practice. The first thing I would say is you may have a 100% passion for a specialty, and therefore coming into general practice would be a con, because you would not be seeing enough of that passion that you have. So some people are born orthopedic surgeons, some people are born renal physicians. That's fine. Then general practice obviously wouldn't work for you, because you are so 100% driven on that one thing. Some people say they miss the acute work. If you go to general practice, you see a lot of chronic disease, a lot of disease that develops over many years. And some people do wonder, do I see enough acute stuff? I really like the emergency medicine. I really like being on the acute ward where things are going on, I have to make decisions quickly. Again, you can tailor it. You can work in out-of-hours settings where it's pretty much all acute work. You can be a GP who does work in A&E as well. So it's not that if you do general practice, you will only see chronic stuff and you'll miss all the acute work. Very important to remember. Loneliness is a thing to think about. A lot of people working in general practice can have the perception of being lonely, because you work on your own in a room. Often you have a clinic of patients that you see regularly. And if you're a locum GP in particular, you may not even know the team that you're working in, the practice that you're working in. So it can become quite a lonely specialty unless you have things in place to make sure that doesn't happen. And again, that's something that can be developed. People sometimes think the responsibility levels are a little bit too much when you're in GP. You are kind of on your own. You have to make decisions. Sometimes if the only doctor in the practice, you have to be able to make decisions fairly quickly without things like blood tests and x-rays and that sort of stuff. So some people think that that for them is not quite how they want to do their medical career, and that's fine. There's a big level of responsibility working as an independent GP. Some people worry that they're going to become de-skilled. They're not doing procedures, for example. So if you're someone who loves doing procedures on a day-to-day basis, you can still, in general practice, you can still become a GP with a specialist interest in things like minor surgery, for example. But if you enjoy doing things like regular chest drains and ABGs and cannulas and things, then maybe general practice is not the route for you. And then the perception is that sometimes all you see is coughs and colds. And again, nothing can be further than the truth. In general practice, you see every bit of pathology. Obviously, there are some things that you see more often than others, but the perception that you'll only see this and you'll get therefore de-skilled is a false thing to think, because in general practice, you do see literally everything that can walk in the door, and you have no idea what's going to walk in the door. It might well be something simple, but it might well be something that you can't afford to risk, like a 2-week suspected cancer referral, for example. So there are cons, but I put it as perceived cons, because often the things that are talked about as cons can be turned around depending on how you choose your working week and career. So my GP journey, I was born in the UK. My father was a GP, so I kind of saw general practice from day one, and it was kind of the only thing that I knew. I thought doctor was general GP. I didn't really know much else when I was younger, so I always thought that to a point. And then when I went to kind of medical school, I started thinking about cardiology. So my aim was to be a cardiologist for a number of years, actually. I came out of medical school in 2005, but by then I'd done a few attachments in medical school. By the time it came around to applying, what the stage that some of you guys are right now for applying for specialty training, I'd done some work in cardiology. I'd done some on-calls, for example, and I realized, okay, that wasn't me. It wasn't quite what I like. It was too very much one thing, and I wanted to see a breadth of other things that I'd seen during medical school and also training. So I applied for GP training in West Midlands, and I finished that in 2010. And since then, like I mentioned, I've done lots of clinical and education roles, a lot of it in general practice, so training other GP trainees and getting them through their years of training. And now I've been full-time medical education since 2018, where I do, again, the majority of my things GP training based, but also lots of other things as well now, for example, like PLAB. So my GP journey was an enjoyable one, but it wasn't as long as lots of other people be GPs. Some people are GPs for 30, 40 years. Mine was quite short, but what I did in that time, I really loved, and I picked up some of those pros that I talked about earlier on. So what are some of the basics for GP training then? So it's minimum 3 years specialty training as a GP ST, GP specialist trainee or registrar. There are some areas that do 4 years. In Scotland, for example, have some 4-year posts, but generally it is still a 3-year training program, which is much less, of course, than lots of the other training programs. It's probably not enough. 3 years is not really enough to understand general practice inside out, but that's currently what the system is if you're applying. Usually within that 3 years, you have about 18 months in a GP setting. So you might be in one clinic, it might be in 2 different practices, but you get at least 18 months of your training sitting in GP land, as it were, and the remaining time, and some areas it's 24 months now, so you have two years out of your 3 years in GP land, but whatever is left, you do in rotations in a hospital setting. So they can be any specialty really, but the classic ones that you will see are things that are very relevant to general practice: psychiatry, pediatrics, emergency medicine, acute medicine. These kind of things are often seen on GP training programs because they're very useful for you as a GP in development. Every year in your training, you need to clear an ARCP, so an annual review of competence progression. So you need to have a few things ticked off each year, assessments done, for example, to make sure that you clear the hurdle each year so you can move on to the next year. And your final ARCP basically releases you for CCT, completion of training, and that's when you're an independent GP and you'll go onto the GP register when it comes to the GMC. And the other thing that you need to do is, number one, clear 3 years of ARCP, but also you need to complete MRCGP. So MRCGP has to be completed for you to complete GP training. Okay, it's not like MRCS, it's not like MRCP that you can take them and not pass everything and then still carrying on doing locums, for example, as SHOs in medicine or surgery. If you do not pass MRCGP, you cannot complete GP training and you cannot work in general practice. It's very, very important to remember that. Things might change, but currently this is how you need to think about your training as a GP trainee. So like we said, 3 years, GPST1, GPST2, GPST3. Every 6 months, you have a review with your educational supervisor. You have one supervisor for 3 years. They review, so the hours are a little bit out of sync here. Every 6 months you have a review, and at the end of every year, like we said, you have an ARCP, an annual formal review to see, can I jump from 1 year to the next, 1 year to the next, and then out of training. There are 2 main assessments, your AKT, Applied Knowledge Test, which you can take from GPST2 onwards, and currently there's something called the RCA, the Recorded Consultation Assessment. It used to be the CSA, the Clinical Skills Assessment. COVID has changed it into RCA. By the time you guys come around to ST3, if you're applying for GP training right now in the near future, it'll be some other exam probably that's been developed with features of both CSA and RCA. But there are 2 main assessments as part of MRCGP, plus work-based assessment, a third component, which is assessments that you have throughout GP training. So what are the criteria to apply for GP training? You need to have a certain number of things. All these are listed on the GP NRO website, the GP National Recruitment Office website. I'd encourage you to go and have a look at that because it changes frequently. MBBS or equivalent degree. You need to be eligible for full registration and hold license to practice from the GMC at the time of intended start date. So the next intended start date is August 22, and then it's February 23. I'll give you some dates in a second, but you need to have license to practice from that point. There need to be evidence of achievement of foundation competencies in the 3.5 years preceding the starting of training. So if you're starting training in August 22, in that preceding 3.5 years, you need to have some documentation to show that I have achieved foundation level competencies. There are lots of different ways that you can demonstrate foundation level competencies. For example, you could be in a UK foundation program, for example, F1, F2, or for a lot of people, you need to be showing evidence from your home country using something called a CREST form, Certificate of Readiness to Enter Specialty Training, that a consultant needs to sign to say that you have these competencies to be able to apply for GP training. We have a blog on how to apply for GP training and also a blog about the CREST form, what it all is, and how you go about looking at it. You need at least 2 years clinical experience by the time training starts. So again, you're thinking in the future now. So if you're thinking for August 22, you need 2 years of clinical experience by that date. And for most people, that is covered quite easily. You need to be eligible, of course, to work in the UK. You need a UK driving license or equivalent transport arrangement because you have to do things like home visits when you're a GP trainee. So they need to know that you can travel to go and see people in home environments, for example. So there's quite a few eligibility criteria. So before you think about applying, make sure you look at these in detail and you get those all ticked off in your mind, because the last thing is you get everything done except for one thing and then you can't apply because of that one thing. So what are the key things about application? A bit like psychiatry that Shinazi was saying, there are 2 rounds per year. There's an August intake, there's an intake for August, there's an intake for February. So for example, currently people doing MSRA in January this year are preparing for August 22 entry. There is another round that comes in February for February 23 start. We'll talk about some dates in a second, but generally there are 2 rounds per year. Sometimes there's a round 1 re-adword as well, so it depends a little bit year by year. It's all coordinated by the GP NRO, the GP National Recruitment Office. Have some great insights and resources there for you to have a look at if you want to. And the whole process of application is basically to try and demonstrate, have you got the ability and suitability for GP training as per a particular specification document. So this document, which tells you that these are all the attributes that we're looking for, are on the GP NRO website. So make sure you have a look there. You apply through the Oriel recruitment portal like other specialties through an electronic application form. And at application, you rank your preferences from all available GP training programs. So you don't apply to West Midlands GP, you don't apply to London GP, you apply to get a GP training program in the UK, and you would rank your preferences when you apply for all those different areas that you want to work in. So it's really important to remember, you only rank places that you actually would say yes to if you get in, because when you do your MSRA, you get a number, a score, and you go into this ranking system, and you will be ranked anywhere that you have put on that list. So it's really important to not choose places you don't want to go to, because then it causes you have to reject offers and stuff like that. So you apply. Once the application window closes, you then register with a Pearson VUE Centre. Pearson VUE Centres are where you go and do the MSRA exam, and there are lots and lots of them across the UK, and you can just book and sign up and go to the one that's nearest to you. And then if you have applied and you do meet, and they'll check everything, and you do meet the eligibility criteria, that's when you're invited to sit the MSRA assessment, the multi-specialty recruitment assessment, which is used for multiple exams like Shinazi mentioned, but for GP, MSRA is everything. It's all based on the MSRA assessment. So what is the MSRA? It's a computer-based assessment, like I said, taken at the Pearson VUE test centres across the UK. It assesses various competencies outlined in the person specification document that I mentioned in the previous slide. And as Shinazi mentioned in psychiatry, because it's the same paper that's done for multiple specialties, two key papers in that exam. You have a professional dilemma paper where you have SJT questions, situational judgment tests. So they're looking at things like, okay, you're in a situation at work, maybe this is something happened with a colleague, or there's some kind of professional dilemma that you're approached with, and you have to choose, you have to rank, for example, what would I do, then what would I do next, what would I do next, what's the best thing to do, next best thing to do, and you're thinking from an ethical viewpoint, from a GMC, good medical practice viewpoint. That is a paper that a lot of people struggle in. We have a lot of resources and courses and mocks for SJTs. And the second paper is the clinical problem solving paper. So again, this is like Shanezi said, like PLAB 1 really. So you have 97 questions, best of 5 usually, but also some EMQs as well, so longer matching questions. But it's testing clinical problem solving knowledge. And again, we have resources and things for that, which you can put out on the chat. The total duration of the exam is around 3 hours. There's no pass mark as such. Remember, it's all graded, so there's no maximum score, there's no pass mark. It's just you need to get as many scores as you can, marks as you can, because you're going to go into this big ranking system alongside thousands of other people who are also trying to get into that ranking system, and therefore the higher you score in MSRA, the more chance you get of getting a training position in a place that you really want to, one that you ranked higher up on that list. So your MSRA score is fully used to determine your rank, and therefore ultimately any offers that you get. In the past, before COVID, this used to be stage 2, MSRA was stage 2, and then you had stage 3, which was a kind of face-to-face assessment. Stage 3 has not now run for a long time because of COVID. It is all based on MSRA. So if you're preparing for MSRA right now, you need to make sure you get it right, because it is very competitive and you want your score to be as high as possible. So some key things about MSRA if you're preparing for MSRA right now, and a lot of you guys are, not just for GP, but for lots of other things as well. Dual-based approach, very important. There's two things you need to boost in your MSRA approach. But number 1, technique. Number 2, knowledge. If you just go and do knowledge and just do lots and lots and lots and lots of reading, then you're going to have gaps in technique. And technique plays a huge difference when it comes to marks. Or if you just do lots of questions and focus on technique and just do question, you'll have lots of gaps in knowledge, because the question banks cannot cover all of the curriculum that you're supposed to know for MSRA. So you need a dual-based approach. Number 1, boost knowledge. So building up knowledge, and number 2, focus on technique by doing lots and lots of questions. That dual-based approach is very, very important. It's not just about doing reading. So knowledge and then questions together form a really good dual-based approach. Question banks, I often get asked about which is the best question bank for MSRA. There are so many different question banks out there. There are so many different resources that you can use. I do not say one is better than the other. I just say you need to find one that resonates with you, because you could do one question bank and your friend could say this is the best question bank, but you don't find it very useful because you don't resonate with the way they teach. However, you find a different question bank much more useful, but your friend says that that's not very good. It doesn't really matter. Do not try and think what is the best one. Try and do a few samples. There's samples on most websites right now. Do a few samples. You'll know very quickly which is the one that I seem to connect with, and go all in on that. With one caveat, have a second source of questions. Don't just focus purely on one question bank for 6 months, because you will get very used to the way they write questions, and then the exam obviously is written by different writers, it's slightly different. So have at least a second source of questions now and then. It doesn't have to be a bought bank. Lots of free stuff on the internet. Just go and do some sample questions once in a while, but choose one that suits you and stick with it. Aim high. Don't just think, oh, I want to get enough to get into my specialty. I want to get enough to get into this area in the UK. Aim high. Aim as if you are going and are applying for the most competitive region in the UK, just against the most competitive people in the UK. Aim high. And this is why a dual-based approach is important, because if you just do loads of questions, you'll have gaps and you won't be able to get as high a score as you probably have potential to. So you've got to plan preparation right, but aim as high as you can, and try not to study alone. Because sometimes with MSRA, if you're in the middle of trying to do your work, your day-to-day work, your on-calls, your nights, etc., it's very lonely to just sit down and do work on your own. Try and get at least a second person with you. Study up, buddy up, give yourself targets, push yourself, because ultimately, when you're with somebody, you get much more done than when you're on your own. It's harder to push yourself. So MSRA is a very passable exam, but you do need to be strategic around it. And we've got quite a few videos on YouTube and quite a few webinars about MSRA, and hopefully you guys have already used those because they cover a lot of this stuff in more detail. Campus wheelpass is what we always talk about. When we talk about medical education, it's all about getting your mindset right. So when you think about these kind of things, make sure you have that campus wheelpass attitude that I can do this, I can score, I can get into the region that I want. So many people think, I'm not going to apply to this region because I know I can't get into that, but I can't get a high enough score. That's the wrong attitude. You can. Every mark is there to get. You just need to understand technique. You need to understand knowledge. When the two come together, then you can get into any single scheme that you like. What are the key dates coming up? So currently people are applying or in the middle of applying for round 1. The application deadline has now finished for round one. The MSRA exam, if you guys are preparing for MSRA in January, you've got about, what, 3 weeks left. Hopefully we can still help you with some of our things. And the offers should be coming out by 3rd of March. But for a lot of you guys, you're probably thinking about round 2, which is February 2023 training begins. You'd be applying, the date, remember, is 26th of July 2022. And the MSRA exam that you would be sitting is between the 2nd and the 9th of September. Offers come out near the end of September, planning for a February 2023 GP training program start. There'll be another round 1 again, which will be looking at August 23. And again, applications come out around about November, the end of this year. So around about November this year, applications will open for August 23, and it works around on that cycle. So how do we help with MSRA? I can see a lot of you guys have bought a lot of our MSRA stuff today with the coupons already. Remember, the coupon is CONF15 SAVE, CONF15 SAVE, for 15% off any of our MSRA resources, or PLAB 2 or PLAB 1. We have quite a few things for MSRA. We have an online course for a clinical part where we teach you all the guidelines that you need to know for this particular condition. We have 2 audiobooks for MSRA, one for the SJT, one for the clinical part. These are designed to buy you time, basically, so you're learning on the move when you're in the gym, when you're traveling, etc. We have 10 pretty tough mock exams for MSRA, 5 clinical, 5 SJT. They put you in that time frame fresher. They push you a little bit beyond what you're probably going to get on the exam so that you feel a little bit more better prepared, looking at technique as well as knowledge. And then we have our flashcards, one for clinical guidelines and one for pharmacology as well. So all of these can be bought separately, or they all come as part of what we call the MSRA all-in-one Gold Pass package, which is something that is a 12-month program, 12-month package that encompasses all of these things: the online course, the 2 audios, the 10 mocks, and the 2 flashcards. But whatever you choose today, please use the coupon CONF15 SAVE, CONF15 SAVE. And I think Pooja will be putting some links in the chat with all of these things in, so you can have a quick look around. We do a lot of teaching for MSRA on social media as well. If you are new to us, 40% of you have not heard of us before. We do so much teaching on social media. The 2 big ones are Instagram and Facebook. If you're on your phone right now, please do open your phone and have a look at us at Dr._Aman_Arora. We do loads of teaching based on pictures, colors. Some people learn very well with that kind of thing. Please do have a look at us there. And Facebook, 2 key things to remember. We have our main Dr. Aman Arora page where we teach, but also our GP training support group, where if you're applying for GP training or preparing for MSRA, this is important to get in part of, because lots of questions come out, lots of common things that people ask each other and help each other out, particularly those applications. So if you're, I think Pooja can put a link to those on the chat, and hopefully we can see you on those streams. We also have loads of videos on YouTube. Hopefully you guys have seen those already, and lots of teaching on Twitter as well. So if you're on any of these streams, please do see if you like us there, and please do put comments and say hello, and I'll be love to get in touch with you on those as well. Take-home messages: GP is very, 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 very popular. Why? Because lots of people will end up being GPs in the UK. It's got a lot of pros and cons. Pros in things like flexibility, range of medicine, design your own career, design your own life. Cons, a lot of perceived cons, but can be turned around depending on how you choose to work in general practice. Make sure you know the application process. Look at the GPNRO website. We have a blog about how to get into GP training that hopefully we can put out on the chat. We have a blog about how to prepare for MSRA as well. And remember, with MSRA, dual-based approach, knowledge, technique, those 2 things need to be looked at together for you to maximize your chance, because it is such a big, it is a very competitive process, because GP is very popular and because lots and lots of people apply. Thank you so much. I've whizzed through. I don't know what time it is. Yeah, a little bit over time. But thank you so much. I'll stick around for questions. Hopefully it was of some value. But before you go, we also teach for PLAB 2. We have something called a PLAB 2 Gold Pass package, where we do lots and lots of work on things like interpersonal skills, time management, data gathering, focused management plans, etc. And also for PLAB 1, we have lots of things for PLAB 1 as well: audiobooks, mock exams, flashcards. So if you need to look at any PLAB 1 or PLAB 2 support, again, the coupon CONF15 SAVE will get you 15% off any of these. And I think Pooja is going to put some links for our PLAB training in the chat as well. What are the subspecialties of general practice? General practice is general practice. It's just a huge specialty in itself, but you can be a GP with a specialist interest in anything. So if you're a GP, if you enjoy women's health, if you enjoy pediatrics, if you enjoy minor surgery, if you enjoy respiratory, you can create your own career and become a gypsy GP with a specialist interest. So there's no subspecialties. There's not really, it doesn't work like that. It's just you are a GP, but you can do lots of other things as you want. For example, someone says, what are the categories of minor surgery? Whatever can be done in out of hospital setting. So lumps and bumps, removing biopsies, that kind of stuff can sometimes be done depending on the individual and the technique as well, and what it is. But there are lots of things that these days can be done in a GP setting. They don't have to go to a general surgeon, for example. So it's that kind of thing that people tend to do.
Sure. There's a question, are there any free sample questions to our mock papers?
Yep. If you go onto the website and look at MSRA and look at MSRA mocks, there is a sample for SJT questions, and there's a sample for clinical questions as well. Because you need to try them, but I'll be confident that when you do them, you'll realize the teaching that we do and how we try and teach you.
And that's the same for PLAB as well.
Yeah, same for PLAB 1 as well. Yeah.
Okay. In terms of specialty training in GP, do you want to cover that a little bit about what life is like as a GP trainee?
Okay, yeah, so it depends really, because remember, you're doing some jobs in GP setting, and that's very different to doing the jobs that you do in hospital setting. So the hospital setting jobs are very much based on the hospital and how they run that department, pediatrics, renal, whatever it might be. So it's hard to talk about it generically there. In your GP setting, you generally, it's you go in the morning, you go home in the evening, you have your clinic set up in the morning, you have your clinic set up in the afternoon, you have a GP trainer there that you can dip in and out of their room and ask them how to help certain things, but you're basically working as a GP, but a supervised GP. So you always have a trainer with you, and you're learning on the role. You're getting into the idea of community-based medicine versus hospital-based medicine. You're getting used to the ideas, things like delaying tests and making decisions without full information, or having gut feeling for is this person unwell or not. Seeing people over numbers of years. That is essentially what you're doing day in and day out in a GP practice. You are doing your own clinics, supervised by your trainer, and you're learning the role in itself, as well as doing things like having teaching sessions and all the other things that you do as part of training.
Bro, and if you want more information about GP training, then as Dr. Aman mentioned, we have our blogs. So I've put out a few links to our blogs there, but certainly if you check out our blog page on our website, there's plenty of blogs regarding working in the UK, clinical attachments, how to make the most of your attachments, what to do post PLAB 1, what to do with your PLAB exams, and really how to make the most of being an IMG in the UK. So please check it out, as well as our YouTube channel. I'll put a link there with all the useful videos.